Hello, everyone. I am Dr. Sin, your board certified OBGYN, national speaker, best-selling author, and vulvar skin specialist. I help women to understand and maximize the skincare of the vulva, or what I like to call the private face, because it's important for every woman to realize that the private face can and should be just as beautiful as the public face. Thanks for joining this evening. And as you guys join, please like and share as you join. Hello, Kimberly. Thanks for joining this evening. And as you guys join, please like and share. So you all know I always start out with a trivia question just to give people time to get into the room. Hey, Lynn, thanks for joining. So I have a trivia question tonight that has a lot to do with grooming for both men and women. Just things we never think about, but sometimes every blue moon you may ponder. So my question to you guys this evening is, who created toilet paper? Does anyone have the answer to that? Who created toilet paper? If you know the answer, please put it in the comments if you know the answer. Who created toilet paper? You can guess if you like. If you don't know who created it, maybe guess as to how long ago it was created. When was toilet paper first used? If you know the answer, put it in the comments. Hi, Carolyn. Thanks for joining this evening. Our trivia question for tonight is, who created toilet paper? Or when was toilet paper first used? If you know the answer, please put that in the comments. We have an incredible topic tonight, and I'm not going to spend too much time waiting on you guys to get the right answer because I want to make sure that we can get through all of the material. But I'll give you just a few to see if you know. Oh, nope, no answer yet. Hi, Diane. Thanks for joining. Our trivia question for tonight is, who created toilet paper? All right. So Adrian says, Joseph Getty. All right. Dr. Google. Now, Joseph Getty can be, we can give him the claim of, being the first person to commercially produce toilet paper in the Western world. Okay. And that wasn't until around 1857. However, the Chinese were using toilet paper all the way back in the 6th century. The first recorded use of toilet paper was actually in 589 AD. Pretty amazing, right? So even as early as the 14th century, the Chinese were manufacturing toilet paper at a rate of like 10 million packages of 1,000 to 10,000 sheets annually. All right. So they were way ahead of the Western world when it came to toilet paper. So since we're always talking about grooming and hygiene and all those things, I thought that would be a good trivia question. So let's get into our topic for tonight. So once again, I am Dr. Sin, your board certified OBGYN, national speaker, best-selling author, and vulvar skin specialist. I help women to understand and maximize the skincare of the vulva, or what I like to call the private face, because it's important for women to realize that the private face is just as beautiful as the public face. So we have an incredible topic tonight that actually affects the private face, and it's called Hidradenitis Suppurativa. And I know you're like, well, what is it? It's a big word, so what is it? Okay, well, let's break this word down. So Hydra, the Hydra is the Greek word for sweat. Okay, so hidradenitis. Adon is the Greek word for glands. So we have sweat glands. And anytime you see itis on the end, that means inflammation. So inflammation of the sweat glands. Now, As the name implies, for many years, we thought that hidradenitis suppurativa was a problem of the sweat glands. And suppurativa means the production of discharge or pus. All right. So we're talking about inflammation of the sweat glands that are producing discharge or pus. Doesn't sound too nice, right? Well, of course, we thought the sweat glands was the problem, but now we have learned that the problem with hidradenitis suppurativa starts at the follicle. Okay, you get blocking of the follicle, and this is a chronic debilitating condition which requires immediate expeditious treatment to prevent long-term, sometimes permanent scarring. Okay, so how does this process start? Well, it starts with excessive development of keratin in the hair follicle. So we all know keratin is the main protein of the hair follicle. So you get this overproduction of keratin, and it occludes or blocks the follicle. With the follicle blocked, you get buildup of not only the keratin, but also sweat and bacteria. And then that follicle becomes dilated. And the wall of the follicle can actually rupture. And all of this is occurring under the skin. And rupture of that follicle can cause abscesses. Sometimes women can develop what we call sinus tracts. And these are tunnels that go from one affected area to the other. Now, on the top of the skin, it looks like raised railroad tracks, okay? It can be very, very debilitating and scarring. And this can lead to scars that are actually disfiguring. Sometimes they can even prevent mobility. So in general, women may see this problem at what we call intertriginous skin areas. That means where two different skin areas come together. So it makes sense that you commonly see this condition in the armpits or in the groin area. Sometimes you may see it around the anus, okay? Because these are all areas where there's friction, where two different skin areas are coming together and rubbing together. Some women may actually have this problem at the belt line or at their waistband or in their abdominal folds or where their bra strap may be. Once again, it's where there's a lot of friction. So women may have painful, very, very painful bumps that often has a malodorous discharge. This can lead to abscesses, nodules, of course, the sinus tracts, and scar formation. And for a lot of these women, mainly because of the location, okay, we're talking about this happening in the private face, okay, it can really lead to embarrassment and shame and even depression. A lot of women suffer in silence. They're even embarrassed to talk to their healthcare providers about this. And that's a problem. So all that we do, we want to encourage or empower women to be okay with speaking about this area, because in this condition and in a lot of others, the earlier you get treatment, the better, okay? The earlier you get a diagnosis and initiate treatment, we can sometimes prevent these long-term, sometimes permanent problems. Okay, so there are some associations with hidradenitis suppurativa. It's associated with cigarette smoking. We know nicotine just messes up the skin in every way possible, right? It's associated with obesity. Now, if you think about obesity, that's more surface area rubbing together, creating friction, so it makes sense. Another possible component with obesity could be hormones. We feel that there is some association with the androgenic type of hormones. There's an association with metabolic syndrome. We've also found that there can be a genetic component with hidradenitis suppurativa. Okay, now, in the general population in the United States of America, if you take 100,000 people, 98 of them will have hidradenitis suppurativa. Now, when you break this down to the Black population, out of 100,000 people, 296 of them will have hidradenitis suppurativa. The prevalence is highest among Black American women, okay? We also know that people with darker skin tend to have a more severe disease burden than people with lighter skin. Also, people with darker skin are diagnosed way later than others. Often they are misdiagnosed as having an STD, or, oh, it's just a little boil, or sometimes they're treated with just basic staph infections. And really, they have hidradenitis suppurativa. There is no true test that we do to diagnose this. This is really a clinical diagnosis. So that's why it's so important for every woman, especially women of color, to be aware of this condition. So if you're noticing that you're getting more bumps down there than what you think you should have, and you start thinking, well, hey, there's sometimes an odor to this. This may not be a simple ingrown hair. I really want you to get in to be seen, okay? Because the key to treatment is early diagnosis and initiating treatment as soon as possible. Now, there are multiple treatment options, and really the treatment is kind of based on what stage you're in. With hidradenitis suppurativa, there are 3 stages. There's mild, there's moderate, and severe. They're called the Hurley stages. And treatments can be as simple as topical antibiotics, so an antibiotic cream that you just put on the area. Sometimes we may have you take antibiotics by mouth. Often oral retinoids can be used. Those are vitamin A derivatives, often used to treat acne. We can use those to treat hidradenitis suppurativa. We often recommend over-the-counter anti-inflammatory medications like your non-steroidals, because this can be extremely painful, and this is already a very sensitive area. Your armpits and your groin are very sensitive. Corticosteroids can be used. If the pain is very severe, we can actually inject steroids into the lesion themselves. Now, there is a group of medications called tumor necrosis factor alpha inhibitors. These medications are also used in the treatment of hidradenitis suppurativa, and they're usually reserved for moderate to severe cases. Some people are treated with laser skin treatment like CO2 lasers. Often laser hair removal can be used, because with laser hair removal, we are actually damaging the follicle, and therefore we are preventing future hair growth. So there is some benefit to that. Now, there is only one FDA-approved systemic medication for hidradenitis suppurativa, and that is Humira. You guys see the commercials for Humira all the time, right? But they never talk about it being FDA approved for hidradenitis suppurativa. So we really need to get the word out there about it. We really need to make sure women of color are aware of this condition, because the incidence is so high in Black women, and we know delay in treatment, you're going to have a more severe course. All right. So we really got to get the word out. Sometimes women, especially women of color, they're diagnosed 20, 30 years later after they've had their first symptoms. So there's a lot that we need to do to keep this from happening. I know I got off on a tangent a little bit. And lastly, we use surgery to treat hidradenitis suppurativa. Sometimes it's just a simple de-roofing, like taking off the top of the lesion itself. Sometimes women need incision and drainage of the lesion. And other times women need excision, like where we actually go in and excise that area. Now, it is recommended for a gynecologist or general surgeon who is has much experience dealing with hidradenitis suppurativa to perform your surgery. And in general treatment, I strongly recommend that you see a specialist, someone who specializes in this area. Now, because this is a chronic condition, okay, this is something that you basically suffer with for the rest of your life. Women do better when they know the things that they can do for themselves, options that they can have at home to treat this condition, or what I should say, manage this condition. So I'm going to give you 5 management pearls when it comes to hidradenitis suppurativa. Okay. And before I get into those, if anyone has questions, please do not hesitate to put them in comments. I will try to get to them during the talk, but if I miss it, I'll do my best to get to it tonight when I go through the comments. All right, so let's talk about these 5 pearls. The first thing that you want to do is change your hygiene habits. Now, this is for women who have hidradenitis suppurativa. And even if you think you might have it, if you're getting recurring bumps down there and you're like, I'm not really sure what's going on, or if they're under your armpits, things of that nature, or if your mom, your aunt, your sister kind of has the same problem, please go in to be evaluated. The earlier we diagnose this problem for you, the better your outcome will be. Okay? So first, you want to change your hygiene habits. This will be the only time that I give you permission to use a mild antibacterial wash. Okay? Normally we say stay away from the antibacterial washes because you don't want to wash away the body's natural defense system, right? But in this condition, because you got all this blockage, you got this buildup where a lot of bacteria can form and you get this really malodorous discharge, a antibacterial wash is definitely beneficial. All right, this will be the only time that I tell you it's okay to use that. Also, you want to do warm baths. Make sure the water is not super hot, okay, because that can dry out the skin, but a nice warm bath will help, and also warm compresses. All right, so those are the things, simple things you can do as far as changing your hygiene habits. Secondly, we need to avoid friction, right? We talked about this condition occurring in areas where you got 2 different skin areas rubbing together. So when we avoid friction, we decrease flares and we decrease the severity of the disease burden. All right. So once again, you want to wear loose clothing. We always talk about loose clothing. In this condition, please don't wear the skinny jeans and even the G-strings and all that. You really want to wear loose clothing. You want to make sure that you're keeping that area dry, okay? You want to avoid prolonged sweat setting in that area. No shaving. Women with hidradenitis suppurativa should not shave. Shaving causes irritation and more friction, and it can make your disease worse. And weight reduction is key. Commonly, hidradenitis suppurativa is seen in obese women. So think about it. If you're obese, you're going to have larger surface areas rubbing together. You're also, with that friction, going to create more sweat. Both of these conditions can make your hidradenitis suppurativa worse. So really focus on weight loss. And if you're struggling with your weight loss, please go see your provider. And if they can't help you, they can get you into the right hands. Okay? No quick weight loss. That's not what we're trying to do. We want sustained weight loss. I know that's a completely different discussion, but I want to make sure that I mention that. The other thing that you can try, which is number 3, is supplements. There are so many supplements out there that have anti-inflammatory properties. Okay? There have been recent studies that have shown that zinc supplementation, zinc gluconate, works extremely well in treating hidradenitis suppurativa. Women are having less flares and less severity of their flares with zinc supplementation. Other anti-inflammatory supplements is vitamin C, turmeric, apple cider vinegar is also great. So these are things to consider, and these are options that you can do on your own and do at home. Now, for women who are using contraception, please avoid contraceptions that are progesterone only, okay? Please do not use the Depo shot, the IUDs that are progesterone producing, or the Nexplanon that goes in the arm, okay? Progesterone can exacerbate or make your hidradenitis suppurativa worse, all right? So please keep that in mind. And lastly, I'm going to call this number 5, is if you're just got to have the hair gone from down there, try other hair removal options, okay? You can try a depilatory cream. Now, depilatory creams are going to weaken the hair and make it easy for you to wipe them away, but it's only treating the hair at the surface. It's not going to treat the hair underneath. So it's really not going to treat hidradenitis suppurativa, but it gives you a hair removal option that's not going to exacerbate your condition. Okay. And then, of course, as mentioned before, laser hair removal. Now, lastly, for all women who suffer with this condition, it is imperative that you have emotional support. This is a chronic disease, and some women have worse flares than others. This is in intimate areas. And if you think you're suffering from depression, please seek treatment. But the first thing I want you to do is go to the Hidradenitis Suppurativa Foundation, okay? It is hs-foundation.org. And you will find a host of resources to really, really help you deal with this condition. I'll make sure in a little while to put their URL in the comments so you can have it. All right. So I hope you guys have enjoyed this. And once again, I am Dr. Sin, your board certified OBGYN, national speaker, best-selling author, and vulvar skin specialist. I help women to understand and maximize the skincare of the vulva, or what I like to call the private face, because it's so important for every woman to know, not guess or assume or think, but to know that the private face is just as beautiful as the public face. And because I believe that to my heart, I have created a product line specifically for the private face called Beauty Below. Okay, it is self-care for down there. We will be launching very soon. And if you want to see what we're up to, please visit beautybelowmd.com. Okay, beautybelowmd.com. And you're able to put your name and email address in there, and you will be updated with all of our launch information. So thanks for joining, and have a wonderful evening. Good night.